Hi, this is Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on this video. This video is about special tests in the spinal examination, and on this video we're focusing on physical examination maneuvers for the determination of radiculopathy and or myelopathy. And the first test I want to demonstrate to you is a test that we traditionally use for the assessment of radiculopathy, and it's known as the Foraminal compression maneuver. Now, sometimes in the literature or in textbooks, what have you, you'll find this described as the Sperling's maneuver. You'll also hear it known as the cervical compression maneuver. So these all refer to the same thing, and we're going to simply refer to these maneuvers as the Foraminal compression maneuvers. So in order to demonstrate these maneuvers to you today, we're going to use our spine model. What better demonstrator than the actual spine model? And so with the Foraminal compression maneuver, the purpose of the Foraminal compression maneuver is to narrow or occlude the intervertebral foramen here. Now, in the presence of a disc bulge or a disc herniation or a disc prolapse, that disc prolapse material will occupy space in the cervical neuroforamen. And with the Foraminal compression maneuver, that added compression or irritation to that disc material could be sufficient to compress the nerve root, in which case your patient will report to you an increase or aggravation of their radiculopathy symptoms. Now, recall that with radiculopathy, we're talking about injury to the cervical spinal nerve roots. With myelopathy, we're talking about injury to the cervical spinal cord. Radiculopathy, on the other hand, is injury to the spinal nerve roots. So, in order to perform the Foraminal compression maneuver, we simply apply pressure to the vertex of the skull in an axial direction down the axis of the cervical spine. Now, it's important that your pressure be directed axially and not angularly, because an angularly directed force can reproduce symptoms unrelated to a disc bulge. We're after radiculopathy symptoms related to disc bulges. So your pressure needs to be directed axially. So the best way to do that is to interlace your fingers like so, and then apply pressure down the vertex of the skull, and down the axial line through the cervical spine. Now, I've seen this maneuver performed many different ways, and many times it's performed incorrectly. I'll see a person, an examiner, located away from the examinee. I'll see the examiner angled obliquely to the examinee. You want to be directly behind the examinee and make sure that your force is being directed symmetrically through both hands, not more one hand versus the other hand. And the force needs to be directed axially down the center of the spine, making sure not to apply pressure with the spine in either flexion or in extension. And this maneuver may or may not aggravate radiculopathy symptoms. The next progression of this exercise, of this examination maneuver, is to place the cervical spine in lateral flexion. Now, lateral flexion in and of itself further narrows the intervertebral foramen, even in the absence of a disc bulge. So in the presence of a disc bulge, the addition of lateral flexion could be sufficient to reproduce the radiculopathy symptoms. So, place the cervical spine in lateral flexion, and then again, apply your pressure axially down the center of the spine. You need to be careful to make sure that you're not simply increasing lateral flexion with your force. That could reproduce symptoms unrelated to a disc bulge and is not definitive for radiculopathy. So the pressure needs to be directed down the axis of the spine. And then you could repeat the maneuver in the opposite direction, making sure to direct your force axially down the vertex of the spine. The final progression in this maneuver is the maximal, so-called maximal foraminal compression maneuver, which involves lateral flexion, rotation, and extension. Now, each of these motions, lateral flexion, rotation, and extension, each of those individually narrow the intervertebral foramen. Combined, they all conspire to significantly narrow the neuroforamen, and this maneuver can be even positive in a normal person, especially in the presence of some degenerative change of the spine. But in a person with an active cervical disc bulge, this maximal compression maneuver should reproduce radiculopathy symptoms. So to perform this maneuver, you simply place the spine in lateral flexion, rotate the head yourself to make sure that you're getting a pure rotation movement, and then apply extension to the cervical spine, and again make sure to direct your force axially down the axis of the spine, not merely increasing lateral flexion or increasing extension, which could give you false positive results.